Even before the pandemic, it was pretty hard to find a mental health professional, with even those facing an urgent need often encountering long waits. A 2018 survey found more than half of adults looking for mental health care in Massachusetts had trouble getting an appointment when they needed it. And now, 19 months into the pandemic, it's nearly impossible to get an appointment, even as people need them now more than ever to cope with the traumas of COVID illnesses, deaths, and isolation. It's an issue the Boston Globe's Meredith Goldstein digs into in one of her latest pieces. In her regular advice column, she used to frequently suggest people talk to a therapist about their more serious struggles, but now, as she writes, I can't just say, hey, go find professional help. It's not that simple. It certainly is not. Meredith Goldstein joins me now, along with Dr. Martin Pierre. He's the president of the Massachusetts Psychological Association, co-owner of Ashmont Counseling Associates, and a staff psychologist at Brandeis University. Doctor, good to meet you, and Meredith, good to see you as always.
Nice to be here.
Doctor, can I start with you? How big is the gap between need and availability?
It's a tremendous gap, particularly during this pandemic crisis. There are overwhelming amount of potential clients who are reaching out for mental health services, and there just aren't enough psychologists to meet this high demand. And this is particularly of an issue for historically underserved and marginalized population who have not sort of mental health services because of access, and also due to the stigma in terms of getting mental health. It's a challenging issue for everyone.
And by the way, I should say, it's not just psychologists, it's therapists, social workers, shrinks, or psychiatrists, as I know we're supposed to call them. Hey, Meredith, based on your research, why do you think the gap is as yawning as it is, as wide as it is?
Well, it's so many different things. It's a confluence of, all of this trauma that people have faced from a pandemic. But also, I think, actually, if I am to spin it positive, some of that stigma went away for certain communities, and just a national conversation about loss made a few people, even in my life, say, okay, actually, maybe I'll seek out, mental health assistance. And of course, then they made the phone call and found no one available. So I think it's sort of this, it's supply demand, it's the time. And, since this piece is run, I've received dozens of emails from exhausted mental health professionals who say they wish they had more hours in the day, that they themselves are experiencing the collective trauma we're all experiencing. And it is not easy to be to do this kind of work, and also to keep track of people's insurance claims. And so at just the right moment where they want to add more hours to the day, they really can't.
And one thing, Doctor, that Meredith also points out in her column is more good news, just like the stigma being mildly reduced for some, is the use of telehealth has gone up. So the good news is you have better access in theory to someone who can deal with your mental health needs. The bad news is you have access, but no one's on the other side of the screen, right?
Absolutely, that's one of the issues. Another issue is being able to access Wi-Fi and broadband, particularly for those underserved populations. And for the older populations, just being able to use technology is a challenge as well.
Doctor, I want to stay with you for a minute. This may be a pathetically naive, useless question, which I know is a hell of an introduction, but we've been told for years by people like you, we've got to start treating as a society mental illness issues the same as physical illness issues. But as either Meredith wrote or somebody else wrote that I read this morning, if someone goes into a doctor, an ER, for example, and says, I've got cancer, or I've got a heart attack or something, we don't say, sorry, we don't have enough staff, go home, call me back in a couple of weeks, or call somebody else. So why does mental health continue to get such second-class treatment?
I think one of the issues are the parity issues that exist, the complexity of insurance companies. For example, there are something called cutout services in which insurance providers do not bill directly, but they outsource this to a third-party company, and it creates this sort of gate keeping, and this complexity in terms of which is a medically necessitated mental health issues. And so it creates a challenge for mental health providers. Some mental health providers have decided to address those issues by just simply not accepting any insurance because of the challenges that exist with those issues.
You're
And
encountering
also
people too. I have to say, I'm sorry, go ahead.
And also of the lower reimbursement rates as compared to medical profession. Our overhead rates is very low. We don't have a whole lot of overhead. And so with the reimbursement, it makes that challenge even more impossible.
And you're encountering that too, about people who write you for advice. Are you not? The shrink I finally found, or the psychologist I finally found, doesn't take insurance, sadly, in many cases for pretty good reasons, Meredith.
For really good reasons. And the time they spend chasing the money they're owed, the time they might be haggling with one insurance company to cover somebody out of network. I mean, I can understand why many mental health professionals are saying, I'd rather just bypass the system and work on a sliding rate. If I'm going to get less, I'd rather work with my own rates with communities. But it's, and this is assuming you can find someone, by the way, right? Like one of the things I mentioned in the story is some of the numbers that insurance companies or directories might give you for a therapist might go nowhere, right? At this point, there is no, what is the clearinghouse for how we find these services? And that's a complicated question too.
Doctor, we've learned through this pandemic, I know it's not news to you, as I read, growing up in Trinidad and Tobago and then Bed-Stuy and on to BC, where you talked about isolation and alienation you experienced yourself as a student of color. What also happened in this past year was the murder of George Floyd, which obviously creates even an extra burden, particularly on people of color. Janae Osterheld, the brilliant colleague of Meredith Goldstein, was with me on the 1-year anniversary of the killing of Floyd. Here's something she had to say.
My year has been like a lot of us were just exhausted and weary and heartbroken. And I think it's like you're wrestling to keep the faith. And it's a different type of tired.
But Doctor, we've talked a lot of us have talked, not just people in the profession like you, about the impact of this last year and a half, particularly on people of color, poor people in this country. But it seems to me we're doing a lot more talk and a lot less walk. We're not doing much about it except talking about how great the disparities are we?
Correct. I think it's a tremendous impact on one's psychological well-being. And because there is a problem with the access of care to provide these services, I think we need to change the system, particularly given attention to the mental health issues as it relates to access and as it relates to competency issues. So I think we really need to put our money where our mouths are when it comes to mental health issues.
So, Meredith, I know how much people who write you depend upon your advice. You got to go out of your way to say, I'm a journalist, I'm not a psychologist, whatever. So what are you telling them in October of 2021 when they say, help, I need help, and it's not the kind of help you can provide? What do you do with them?
So many times I've said, well, go find therapy, right? And that's not so easy to do right now. And Dr. Pierre was nice enough to help me with some tips for people, one of which was to embrace group therapy. There are sort of workarounds of the system, right? Also, one of the wonderful tips that he gave me was even just calling insurance companies and doctors to get this care can be taxing. So to get your network of people together, I am personally great at calling insurance companies for other people. Happy to do that for friends and family, right? So this is, it takes a community to get the care you need. So to call upon those sources, and even just to tell people, seeing a doctor, your own primary care physician, if you have one, to say, help me find these services, right? I think getting help requires asking a lot of people for help, unfortunately, these days, right. but people are more open. So I'm certainly doing that. And what I committed to in this column that I wrote was to calling some of these professionals myself. Advice columns are generally supposed to be entertainment and some group therapy that is not official therapy, but what can I do even in my sort of more passive column that is much, in the spirit of Ann Landers, what can I do to get you the help you're not getting? And so many wonderfully qualified mental health professionals emailed me just this morning to say, give me a call. I can't diagnose anybody over
That's
a letter,
great.
but I'm happy to help.
So, Dr. Pierre, what are you telling people? And on your list of what you tell them, does it include accessing some of these relatively new online services we see all over TV?
Yes. So what I say to them is to have your friends and family members call. I tell them to to take advantage of group psychotherapy, and also looking into faith-based counseling as well. So reaching out to pastoral counselors and your pastors and so forth. And so what I also advise is engaging in psychoeducational groups. I run these groups because I could get more involved and more volume and more people involved in psychoeducational group versus one-on-one therapy.
Dr. Pierre, thanks for your advice and time. Meredith, terrific column. Good to see you as well. I appreciate it.
Yeah, you too.